Hi, good evening. This is Mr. Alan again, and tonight we're going to have our Facebook Live on nursing prioritization and delegation. So tonight, join us again for another session. We're going to have some few questions on prioritization and nursing delegation, of course. And again, I would like to introduce you myself. My name is Mr. Alan Matus, and I am a nurse educator. I have been teaching nursing students for 25 years, and also, I'm the author of the book, The Simple, Fast, and Easy NCLEX Review book that you can get from Amazon. So for tonight, I have prepared some questions for you, and I'm so excited. And hopefully, you'll be all participating. And of course, we'll be giving the rationale for the questions that you're going to be answering. Okay. But before anything else, I am so excited because I'm going to introduce to you our special guest for tonight. So for tonight, we have a special guest joining us, and she is a recent passer for the NCLEX PN examination, and her name is Kim Bernil. So we're going to be asking her a question on how she did it and what's her experience like in passing the NCLEX PN. So she is officially a Matus Nursing Review student and our alumni or alumnus for this community. So let's welcome Kim. Hi, Kim. How are you doing? Can you hear me? Okay, hold on. Yes, there you go. So, hi, Kim. You're live right now. And how are you doing so far? How are you feeling after your NCLEX passing experience?
Hi, sir. Good evening. Good evening, everyone. I am overwhelmed,
Mm-hmm.
sir. Yeah. It's like I'm relieved.
You're relieved
Like,
finally, right?
like
Yes.
NCLEX
So,
is over.
yes, tell us a little bit about your background. You took the NCLEX, and that was when did you take the NCLEX? It's May, right?
Yes, sir. Exactly. Last week, last Wednesday, I
Yeah.
took the NCLEX PN,
Mm-hmm.
and this was my second take, and the first time I failed.
Mm-hmm.
And until I found Matus Nursing Review sometime in January, and
Uh-huh.
then by February, Sir Alan's Saturday class
Mm-hmm.
started, and then we were down to our seventh. Was it seven sessions, or
It
isn't
was
it?
two seven
And
session. Yes.
then yes, and it was great. It's it's like a classroom experience. It's
Mm,
like you're back to school. I graduated 8 years ago, so my content is it's like it's all gone. So
yeah.
to enroll at Sir Alan's class was the best decision I made this year. So yes, and then actually one of the struggles I had before taking the NCLEX. I am working because of this COVID. It's like I had to work almost 7 days a week,
Mm-hmm.
and I usually start 4 in the morning and work 8 hours. And most of the time I get home, I'm drained
Mm-hmm. Yeah.
physically, and like it's like I don't really have time to study, and
Mm-hmm.
it's just different. So yeah, and then I wasn't really ready to take the exam, but my ADT is gonna expire soon, so it's like no, you have to take it as soon as
Mm-hmm.
possible. So yeah, so I just used Sir Alan's book. The workbook really helped, and of course the Facebook group and this Facebook weekly live helped a lot. There's a lot of prioritization and delegation questions, my NCLEX, and I had 70 questions.
Oh, that's
So
good. Yeah. So you
yes,
ended
it's
right
70
away. Very good.
questions. And at first I'm like, I'm not gonna make it. But yeah, because the NCLEX is like everything's correct, but which is the most correct one?
Mm-hmm. Yeah.
So that's what I learned from yes sir, from this Facebook group. It really helped me a lot. So, and also Sir Alan's doing the flashcards on Quizlet. Guys, it's really helpful.
Mm-hmm.
So from pharma and the prioritizations as well. So yes, and the support. you can always reach out to Sir Alan. So yeah, even after the exam, so he's really into helping us to pass our NCLEX. So once again, sir, thank you.
Yes, yeah, of course, yeah. I'm really very happy, especially that you mentioned about the online academy that it's helping you, especially with if you're busy, you're just on your phone and then listening to the lectures again. Especially that you want to refresh your content so far.
Yes,
So, what
sir.
were the strategies that you used in order to overcome the the difficulty of reviewing and at the same time you're working? So, what did you do basically? Because a lot of people here are working a lot and they get distracted, and that's one of the reasons.
Right.
How did you get motivated and just kind of really be on the spot on really reviewing for your NCLEX?
Yes, sir. So that was my motivation. I'm like, I can't work 7 days a week.
Mm-hmm.
So I need to do something. I
Mm-hmm.
need to do something for my future. I know I want to pursue my nursing career, and this is like one step. One step. I know I'm getting there. So I do 2 to 3 hours a day at
Mm-hmm.
least. So I watched Sir Alan's video because I made a study calendar. Actually, it comes, Sir Alan will send you a study calendar. So, for example, today you want to do this, and then the other day this. And at the same time, you were answering the workbook while
Mm-hmm.
watching the video at the same time. So yeah. And then while I was actually taking the exam, I keep on hearing Sir Alan's voice from the video.
In your
So
examination, right?
from
Yes.
at the exam, because
Um,
most of the questions were actually tackled in the online academy, from the
mhm.
fundamentals of nursing, prioritization and delegations. They're all there. So yeah, I mean, past 3 hours I can't do it anymore. It's like I'm not retaining anything. So
Uh-huh.
that's it, 2 to 3 hours, and that's okay. That's okay, guys. So yeah, and then I always attend the weekly Facebook Live.
Yes, that's good. Yes.
Yes, sir.
Well, thank you very much, Kim, and I
Thank you,
hope that
sir.
you're successful in your endeavor. And I know that you're gonna take your
Thank you, sir.
NCLEX also, your RN, I
RN,
guess.
sir.
Yes, our
Mm-hmm.
RN program. So very good. So you'll have two licenses later on. You're gonna have your
Oh,
LV and your RN
crossing
license.
my fingers, sir. Hopefully, sir, this year as well, to keep the momentum going.
Mhm.
So yeah, thank you, sir.
Yes, we are very proud of you, and you're one of our pastors in the program. And we definitely cater to students who have challenges in passing their NCLEX, and that's why we have the workbook, and then we also have the online academy to make sure that you have all methods or means on how
Yes,
to
sir.
study here, since you're very
Mm-hmm.
so, and you can
Yes,
always
sir.
attend as well.
It's a
Well, thank you
package
very
deal.
much. So
Thank you,
thank you
sir.
very much. Good luck, and
Thank you, sir.
see you again in our review program, hopefully. Okay.
All
All
right,
right.
sir.
Thank
Thank
you very much.
you.
It's nice to have you here in our show. Maybe tonight it's a show. Okay, it's an interview. All right.
Thank you,
Okay.
sir.
Thank
Good
you very much.
night.
Kim. Okay. Have a good night.
Thank you, sir.
So thank you very much, Kim. So hopefully everyone, Kim's story is a little bit of an inspiration to all of you. She's been very busy, and of course, our review program or live class every Saturday was cut off because of the COVID situation. So congratulations, Kim, because of being a guest here tonight, and also for passing your NCLEX. For some reason, we have an extra shirt that we can give you. So you're gonna be having our special sweatshirt, as our password for the NCLEX. So you'll receive this in the mail. So give us your address, and we'll send you this very nice sweatshirt that we have. Okay. So for tonight, everyone, are you ready? So we're gonna have your prioritization questions. So we have 4 questions, 2 prioritization questions, and then we have 2 delegation questions. Okay. For our prioritization questions, everybody, okay, it's going to be all about what is the first thing that you're going to do. So in the NCLEX, I told you before that some of the formats for prioritization will be giving you 4 patients, but this one will be what will be the first thing that you're going to do. So we're going to be practicing on that a little bit in our first 2 questions, okay? But before anything else, let's welcome whoever is here tonight. So we have Anne and Jermaine. Thanks for being here tonight. Anne is actually one of our students in the 12-week fast track NCLEX review right now. And also we have, I'm not really very sure how to pronounce the name, but it's Emion Simon Moore. Okay, so welcome here in our Facebook Live. And also, everyone, please don't forget to share this with your friends right now so that they can see us being live here. Okay, so share this Facebook Live, and I'm very much sure and excited that your friends will be benefiting from this program. Okay, so now let's have the first question, everyone. So the first question for tonight is going to be prioritization again. So again, I told you that this is going to be about what is the first thing that the nurse is going to do. All right. And again, what I told you the last time is that in the NCLEX, they're not going to give you the diagnosis of your patient, but you have to identify the symptoms and find out if the symptoms are signs of complications. Okay. But actually, at this time, me and my students in the school, we are actually doing the virtual simulation because of the whole coronavirus. And our students now are learning through the virtual simulation platform. And it's really very exciting because it's helping them develop their critical thinking. Okay, so let's show the picture or the question. So the question for tonight is, the nurse is caring for a client diagnosed with unstable angina pectoris. During morning rounds, the client reports that he suddenly has severe substernal chest pain that radiates to the jaw and the left arm. Which of the following is a priority nursing action? A. Notify the rapid response team. B. Ask the UAP to obtain the crash cart. C. Administer sublingual nitroglycerin. Or D. Assess the apical pulse and the blood pressure of the patient. So, what do you think? Okay, what do you think is the answer to this question? What will you do first? This is a prioritization question in the NCLEX. So, everyone, put your answer. Okay, and let's see. Is it A, B, C, or D? So, remember, this is a patient with unstable angina pectoris complaining of chest pain. Okay, so is it A, is it B, is it C, or is it letter D? Okay, so put your answer, everybody. Okay, so again, remember this question, everyone. This question is about a patient having unstable angina pectoris. Now, if you have to review, unstable angina pectoris is a type of angina pectoris wherein it is unpredictable and there's a higher chance of developing myocardial infarction in the next 18 months. Unstable angina pectoris means that this is the type of angina that will be difficult to manage with pain medications, and at the same time, the blockage probably is much bigger now, and that's the reason why the angina is becoming more unstable. Now, if a patient or client who is diagnosed with angina complains of chest pain, what will be your priority? Is it to assess the patient, to notify the rapid response team? So let's see what's the answer of some people here. Some of you answered letter C. So Candice, you said letter C. Okay. Jericho, you also said C. Rhoda, letter C. Okay. Marella, letter C. Okay. So let's see what is the answer for tonight. Okay. So the answer to this question is actually going to be letter. Yes, the answer is going to be letter C, everyone. So letter C is the answer to this question. So in this question, the first thing you really have to do is to give the nitroglycerin right away because the chest pain represents the lack of oxygenation to the heart muscle. So it's important to give oxygen or else this can lead to myocardial infarction. You may assess the pulse and the blood pressure, but at this time, that is not the priority. Okay, that is not the priority. Notifying the rapid response team is not also the priority, and at the same time, you don't want to ask the UAP to obtain the crash cart. So always remember this. This is the one thing that I've told you, that if the client is in distress, you have to intervene immediately. You have to do something immediately. Okay. The only time that you can assess further is if your client is not in distress and you want to gather more information about what's going on with your patient. Okay. But at this time, it is a patient who has chest pain, and you need to immediately give the sublingual nitroglycerin. Especially the keyword in the question says suddenly. You know, suddenly means that it could be something that is serious, of course, and at the same time, the word severe chest pain there. Okay, so the answer is going to be letter C, everybody. Okay, so you don't want to assess the epical pulse and the blood pressure because uh, time is muscle. The more that you delay administering nitroglycerin, the more that you are depriving the heart muscle of oxygen. So remember this concept in the NCLEX, okay? So congratulations to those who got the right question, okay? But before anything else also, can you please let me know which country or which location are you coming from tonight? I would like to find out where's the location of the audience, you know, all these nurses. Of course, this Facebook Live is international, so I would like to see where you're coming from, everyone. Can you please type where's your location? I'm going to show it on the screen. Okay, are you coming from California? But by the way, me, I mean, I'm in Long Beach, California. This is the base of our review center. It's Long Beach, California. Okay, so Houston, Texas. So Kenny is in Houston. Hi, Kenny. How are you doing? I got your email, and I hope I did respond. Okay, but if not, then let me know. All right. Then we also have another person from Texas again. Bindo is also from Texas. Okay, very nice. Okay, and then also we have Misumi from Texas as well. So we have a lot of people from Texas. Also, we have Joyce is from New York as well. Okay, so thank you very much, guys. Now let's have another question. So this question is another prioritization question. So let's read this question, everyone. So while assessing a client with left-sided heart failure, the nurse noted several severe shortness of breath, production of pink tinge frothy sputum, and pulse oxygen saturation of 85%. So which nursing action should be taken first? A, place the client in sitting position. B, administer intravenous furosemide. C, auscultate the lungs for crackles. Or D, obtain the crash cart. So what will be the first thing that you have to do in this situation? Okay, so we also have Melissa is from the Philippines. Thank you very much for being here tonight. We also have Jericho is from Pampanga, Philippines. Very nice. Okay. So we also have from Riverside, Emion, Simon Moore. Thank you very much for being here tonight and share this Facebook Live, everybody, is what I have said. So what do you think is the answer to this question wherein the patient is having severe shortness of breath, production of pink tinge frothy sputum? What do you think is going on here? So give me your answer, everyone. So one person says auscultate the lungs. Okay. So another one you have. What else do you have? Other people, what's your answer? Okay. So what do you think is the answer to this question? What is the first thing that you have to do? Your pink dish frothy sputum indicates the presence of what complication? That is really something very important for you to analyze. What is severe shortness of breath, and then you combine that with pink tinge frothy sputum and a pulse oxygen saturation of 85%. Now, what is pink tinge frothy sputum? What is that? If you have to go back to your basic core content, it is an emergency situation that indicates the sudden accumulation of fluid in the lungs of your patient. This is sudden pulmonary edema or acute pulmonary edema. So basically, your patient is drowning in his own secretions. Okay, so this is an emergency. And looking at the number 85%, okay, 85%, that is a low pulse oxygen saturation because your normal is going to be 95 to 100%, right? So some of you, what is going to be your answer? What is the first thing you're going to do? Yes, you're correct, Bindu. That's going to be pulmonary edema. Are you going to assess or are you going to alleviate the shortness of breath of your patient? Okay, so the answer to this question, somebody said letter A. That would be Jericho said letter A. Okay, some people said letter B. Okay, so the answer to this question is going to be letter. Take note of this in the NCLEX exam, everyone. It's going to be letter A. All right, you have a client right in front of you who is suddenly cannot breathe. Okay, when you're auscultating, you are not helping out the situation. Okay, when you're auscultating, you're just trying to assess if there's pulmonary edema. Of course, you can do that, but the first thing that you have to do, knowing that you're very sure your patient is having pulmonary edema, is that you're going to have to place the client in a sitting position. Okay, in the NCLEX, when it comes to acute pulmonary edema, the first thing that we have to do is to put the patient in an upright sitting position, or it's going to be a high Fowler's position because the accumulation of fluid in the lungs, okay, interfere with breathing. So the answer is going to be letter A. Congratulations, Pratisha. So take note of that in the NCLEX. Assessment is very tempting, okay? However, assessment is an answer that you can put only if you are sure first that your client is safe, okay? If your client is in distress, then you cannot assess. You have to do something first. Okay? And sitting position there will alleviate the shortness of breath of your patient. Okay? So congratulations to those who got the right answer. Okay? All right. So let's have the next question, everyone. So the next two questions will be on delegation, but I do hope that you learned something with the first two questions that we have for tonight. Okay? So thank you very much. So now let's have your delegation question, everybody. Are you ready for your delegation, everyone? Okay, so always remember that I told you that in your NCLEX, you will have questions on prioritization and delegation. So for this delegation question, it's really very exciting because this is a very nice question. Okay, so the registered nurse is working together with the licensed practical nurse and unlicensed assistive personnel in the medical surgical nursing unit. So, which of the following is an appropriate delegation of tasks? A. Ask the UAP to elevate the legs of a client with varicose veins. B. Instruct the client to monitor a client, or instruct the LPN to monitor a client who recently had a bowel resection surgery. C. Request the UAP to flush the Foley catheter of a client with urinary tract infection. Or D. Assign the LPN to assist a client with dementia during ambulation. So, which one is the correct delegation of task here? Okay. So which one can be delegated to the UAP? Again, remember that what you can delegate to the UAP will be activities of daily living, like hygiene, for example, bathing, for example. However, aside from the scope of practice, you also have to think, is the patient stable or unstable? If it is an unstable patient, do not assign the UAP to an unstable patient. You do it yourself, okay? If it is an unstable patient. Okay, so most of you answered letter A. Okay, so we also have Rhoda also answered letter A. Okay, it seems like a lot of you are getting the correct answer in this question. So we also have Paul. Okay, there's a lot of answers in the comment section. I'm having a hard time clicking and clicking and putting the names of the persons. So Kenny also letter A. Let us find out, guys, if letter A is the correct answer. You might be surprised of the answer, everybody. Okay. All right, so the answer is going to be letter. Okay, you are all correct. Letter A. Ask the UAP to elevate the legs of a client with varicose veins. But I do have a question for tonight, everyone. Why do you think letter D is wrong? Can you please tell me the rationale? Why is letter D wrong? Okay, we're sure letter B is wrong because letter B, that's an LPN monitoring a client with bowel resection. We already knew that um, registered nurses are not supposed to delegate clients who need monitoring, who need complex assessment. And this is a person who recently had a bowel resection surgery. So you're not supposed to assign that to the LPN because that's an unstable patient. Okay. What about letter C? UAPs cannot flush the Foley catheter of a client with UTI because that's not within their scope of practice. Not within the scope of practice of the UAP to flush the Foley catheter. So letter D is the answer. But why letter D? Because why not assign that to the LPN, a client with dementia? And the reason for that, very good. Okay, so somebody got the answer. Okay, right. Marella, very good. So letter D, ambulation is for the UAP. You don't want an LPN to ambulate a client because that could be done by the UAP. Any simple task, any that is routinary, could be done by the UAP. The only time that the UAP may not be able to ambulate a patient is maybe a patient who is having unstable condition. Okay, so maybe a patient who is recovering from a very recent surgery, for example, then the UAP cannot ambulate that patient. Okay, so any patient who is unstable. All right. Okay, so the answer is going to be letter A. Very good. So we're gonna have our last question for tonight, and then of course some of you were asking me earlier if there is a contest for tonight. Well, anyway, probably next week we're gonna have a contest. We're gonna give away again, probably another access to our online class for next week. Okay, so just wait and see if we have a contest. Okay, but again, share our Facebook Live for tonight so that your other friends will also benefit. Okay, so our last question for tonight, everyone, is going to be select all that apply. It's going to be on delegation, select all that apply. Okay, select all that apply, delegation. So let's see if you can get the right answer for this. Okay, so number four, this is all about a assignment of tasks to UAP. So let's read the question, everyone. So the charge nurse, okay, is assigning clients to four unlicensed assistive personnel in the critical care unit. Which of the following assignment of tasks are appropriate? Select all that apply. A. Obtain the vital signs of a client with multiple sclerosis. B. Measure the weight of a client diagnosed with ulcerative colitis. C. Apply nystatin cream to the arms of a client with tinea corporis. D. Ambulate a client after a recent hip surgery. Or D. Or E. Feed the client with Alzheimer's disease during meals. So, which one do you think is an appropriate delegation of tasks to the UAP? Okay, I hope that you all guys are able to get the right answer on this one. Okay, okay. So this is select all that apply question. So what do you think is the answer? A, B, C, D, or E? I would like you to remember that when we delegate to the UAP, number one is we have to find out if that task or determine if the task is within the scope of practice, and then at the same time, is the patient stable or unstable? Okay, so what will be the answer? So Paul said it's going to be A, B, and E. Okay. So can you please rationalize why the other options are not correct? Okay. So Bindo Jose also mentioned letter E, A, B, and E as well. Okay. Then we also have Kirmaljit Brar, okay, also mentions ABE. And of course, Regine also mentions A, B, and E. So let's see, everybody. Can you please give your rationale? So you're doing very well with delegation. So I think you're all ready to get the board examination or the NCLEX, okay? So what will be the answer to this question? The answer to this question is going to be A, B, and E. Very good, everyone. So Pratixa said that recent surgery. So that's why letter D is not included because that says after a recent hip surgery. So meaning that that is an unstable patient, especially if it says like hours after surgery. Let's say day before after surgery. So that would be an unstable patient. Okay. Now also applying your cream, nystatin. Nystatin is a prescription medication. It only has to be applied by a licensed nurse because the licensed nurse is the one signing that off in the medication record, right? So that has to be A, B, and E. Okay. So recent surgery, your UAP is not allowed to ambulate the patient. Basically, yes. Letter C. Why is letter C not the answer? Well, of course, not letter C because that's for the LPN. Okay. Creams could be applied by the UAP. In some states, are allowed to do that as long as non-medicated, non-prescription, like lotions, for example. But then when you're having nystatin cream, that is an antifungal medication. Okay, so that has to be administered or applied by the LPN. So the answer is A, B, and E. Very good. Okay, so Paul, tomorrow is your test. Good luck on your examination. Let us know what happens. Okay, so very good, everybody. Okay, so medicine is for licensed nurse. Very good, Miss Brar. All right. So again, thank you very much, everyone. So before we end for tonight, I would just like to plug in a little bit about our program. So again, we do have the live NCLEX review in the classroom, but that's suspended for now because of the COVID situation. But we do have the online NCLEX Academy, and we do have live webinars in the online NCLEX Academy. We have the Tuesday schedule from 7 to 10:30 p.m. That would be the 12-week fast track NCLEX review, and we do have also a 10-day comprehensive live NCLEX webinar starting in July 18. So maybe that's something you're interested in. It's from 8 to 2 p.m. starting in July 18. That would be the 10-day comprehensive live NCLEX review. Comprehensive, so meaning even for international graduates. So I'll be teaching the class and it's a webinar, guys. Okay. We do have self-study programs in our online NCLEX Academy, and we have hundreds of students in the program right now. So it's really very exciting, and the feedback has been very great. Okay. So now another one, of course, everybody knows this. I do have my book in Amazon. It's also available in Barnes and Noble. Okay, so you can review this book. And of course, who has my book right now? What can you say about my book, everyone? If you feel the book is really very helpful, guys, who has my book here? What can you say about my book? It's in Amazon, and Simple, Fast, and Easy NCLEX Review is the title of the book. Okay, and there's also a Kindle version. A Kindle version is available for $9.99 only. All right. So just contact Amazon, especially for the delivery of the book. Right now, we have some challenges because of the COVID situation. Okay. So who has the book? Kenny, do you have the book? Oh, very nice, Kenny. I hope you really like the book. I hope that you're enjoying reading it because it's really very easy to the eyes, and it's not really overwhelming. Okay. So very good. Okay. So thank you. Yeah. So awesome book. Thank you very much, Pratisha. Okay. So you have the workbook and you have the book as well. Okay, very good, because you have the enrollment that are online NCLEX Academy. Very good. All right. So Marella also has the book. So we have people here who have the book. Guys, thank you very much. I hope that you learned something tonight, and spread the news, share the Facebook Live with your friends, and I hope that you learned something about initial nursing actions. Again, if the client is unsafe, if the client is in distress, you have to intervene immediately. Okay? Be careful when picking the word assessment. Okay? So always remember that. That is our key lesson for tonight. All right. So thank you very much, everyone. Thank you very much for being here tonight. And I'll see you again next week and find out if there's a contest. And if there's a contest, then spread the word and let your friends know. Thank you very much, everyone, and have a nice night.